So I used to be a debate coach, right? So I coached critical thinking, and and for me, like, my training as a student was you got to take both multiple sides of every debate. You have to understand not just your arguments, but also your opponent's arguments. That's a rare thing these days, and especially in a world of social media and algorithms that continually restrict what we see to the things that we probably already believe or already think anyway. We really do have a crisis of critical thinking in not just in Minnesota, but in the United States. And I work a lot on like data center stuff at the Capitol, but I really think it's the AI and the social media aspects of this. There are the understated reasons why we're at here, where we're at today.
Why isn't AI a bigger campaign issue for Democrats?
I don't know. That's a great question, Ben. I think it should be. AI is. Okay, first of all, the AI right now that we have is not really artificial intelligence, okay? It's what we call large language models. These are basically, it's regurgitating what it thinks a person who is using that language would respond to a prompt. It's not really, thinking at all. There's no cognition happening. It's regurgitation of words that other people have written somewhere else. But we're starting to use this to do incredibly consequential things. Like, so right now, the legislature this week, there have been hearings about preventing AI from being used to make medical decisions about whether things are covered or not. Well, duh. I mean, seriously, like, why are we letting a computer decide this? I mean, like, it's not like the humans are doing a great job at anyway. I'll be honest about that. But certainly, the idea that we're going to use AI to automate things like whether or not the surgery that your doctor says you need is actually covered by your insurance is deeply and profoundly wrong.
It is wrong, but it's just covered for the insurance company.
Yeah, I mean, and ultimately their goal is just to make more money, and the way they make money is by denying care, right? So, I mean, these are all of these incentives are wrong, and they need to be redone, right? And I think that's why I really believe we need single-payer healthcare in this country. I mean, we need it either at the state level and growing it out like through Minnesota Health Plan, or we need it at Medicare for All, kind of a national level. But until we get the profit motive out, we're going to have every step along the way, there'll be a temptation to use a tool like that to automate the denial of care.